Hello and good afternoon. I am Dr. Gary Carlson, and I will be retiring in the next 6 weeks or so. So just wanted to give a few words of thanks and discuss a little bit about my plans. I have been a physician since 1986. That's when I finished medical school. So that's 35 years of being a physician. Of those 35 years, I've been practicing in Northfield for 30 of them, most of those years at the Lawler Clinic. But as you all know, for the last 3 years, I have been practicing here at the Northfield Retirement Center, as well as a few other facilities in the town, and including Lonsdale. And I've really enjoyed these last 3 years of focusing on geriatric treatment and patients. And even though I'm ready to retire, I will badly miss all the relationships with the staff and the patients that I've formed over these last few years. This is a wonderful organization, a wonderful place to practice, a wonderful place to live, and I've just been very thankful for that. A few questions I'm sure that people will ask, well, who's taking over for you? So Marianne Loftis is the nurse practitioner who has been with me for over a year, working in the long-term care center as well as here, and she will continue in that role. The physician who will be taking over for me will be Dr. Steve Lawler, and he's been the medical director over at the long-term care center for over 10 years, I believe, and will basically just transition over and take over supervision of the assisted living, working in conjunction with Marianne Loftis. The other question I get a lot is, well, what are you going to do when you retire? And I have a lot of things that I am planning. Of course, the 35 years of being a doctor and probably the 10 years prior to that training to be a doctor didn't leave me a lot of time to do other things. And so that's what I'm going to focus on, those things that I didn't have as much time for. And specifically, I like to play the cello and the piano, and I hope to do a lot of that. In fact, I'm going to a cello camp in Michigan in June to see if I can get better at my craft. The second big project I'm going to have is that my wife and I have ordered a van, looks like a big cargo van, and you've probably read about people who then take these empty cargo vans and make them into RV units. And so I'm going to spend a lot of time fixing up this van and then hopefully doing some traveling in the United States to the different national parks and so forth. So those are my plans for now. My last day will be the last day of April. And again, there will be no break in continuity of care. Marianne Loftis will just continue through, and then Dr. Lawler will take over on May 1st as a supervising physician.
Hello, I'm Dr. Steve Lawler. I have been working in Northfield here for about 24 years now. I started out at the Alina Medical Clinic, and as I was practicing medicine there, I would come here to the care center and see my patients over here. I've been medical director of the Northfield Care Center for almost that long as well. I took on that role fairly soon after I came to town. I've been doing nursing home work exclusively for the last 6 years. Actually, the last 8 years, I've been doing nursing home work exclusively. And coming up here next month, I'll be starting to see folks over there at the assisted living facilities. So all here part of the Northfield Retirement Communities campus. I'll be taking over for Gary Carlson, who I know has done an amazing job in the time he has spent here. And it'll be big shoes to fill, but I'm looking forward to meeting you all.
My name's Marianne Loftis, and I'm a nurse practitioner with Genevieve. I've been practicing as a nurse practitioner now for about 18 months. Prior to that, I have been working in long-term care since 2006, mainly in dementia care, though I have a great passion also for TCU. During the transition, I will continue to be the nurse practitioner for housing. A little bit about myself. I've been born and raised in Northfield. I have 3 children, 5, 3, and 1. and I'm just really excited to continue to provide care.